non-invasive, high-grade papillary urothelial carcinoma. Those were the words my wife and I read in the biopsy report that was uploaded into our portal just a few days before Christmas 2023. We spent the Christmas holiday going through the motions and smiling for pictures while we waited for an appointment with our urologist. We went into that appointment knowing that we were going to tell the doctor that we wanted to ask for a second opinion at the cancer center. For the first time, a medical profession told my wife and I that I have cancer. But what really surprised us was that my doctor said because of the location of my cancer, he wanted to send me to the cancer center before we even got to ask for the second opinion. What my urologist said needed to happen was a combination of BCG treatment and a surgery that would remove the section of the bladder that contained the diverticulum. And I appreciated his honesty when he told me that a surgery of that nature goes beyond the scope of his abilities as a surgeon. So he would rather have me see a doctor at the cancer center. At the cancer center, the doctor conducted 2 more TURBT procedures to completely map my bladder and get an understanding of what he was actually dealing with. Over the course of the visits, he debated between doing the surgery and then BCG or doing the BCG treatments followed by the surgery. He ultimately decided to do the BCG treatment first, followed by the partial cystectomy, as it's called, or partial reconstruction of the bladder. He explained that in that surgery, he would go in, make an incision below my navel, and go in and remove the diverticulum and then put my bladder back together. And then he kind of casually mentioned that he would probably have to relocate one of my ureters. Like, no big deal. After the surgery, my doctor sent me home with a catheter for about 2 weeks, and I also had a stent in the relocated ureter. I wasn't able to lift anything heavier than 5 pounds for about 8 weeks, and I was able to start to resume working activities officially within a few weeks, but the recovery was difficult. I absolutely hated having a catheter. The stent also stayed in for a longer period of time until the ureter was completely healed. And at my post-op appointment, I went in for a CT urogram where they put a dye in my bladder and they took a CT scan to make sure that nothing was leaking from the bladder and that the bladder had completely sealed back up from the removal of the diverticulum and the relocation of the ureter. After I passed that test, they removed the catheter, which was a huge relief. They did keep the stent in for a few more weeks to keep the ureter open, and then eventually that was removed. Both while I had the stent and after the stent was removed, I did experience something called flank pain, which was a very unusual sensation, but thankfully that eventually subsided. The biggest challenge in recovery was that I just wanted to return to normal activities as soon as I could. They had told me 8 to 10 weeks, so I went back to work full speed, going up and down stairs, walking around at work, being very active, and very quickly I learned that my core was very much disrupted by the surgery. So eventually I sought the support of an orthopedic doctor and I went through physical therapy to regain my core strength and to eliminate some back pain that I was starting to experience. I was actually cleared from physical therapy about a year to the date from the original diagnosis that my wife and I read from that biopsy. And for the first time in a year, I truly felt back to my original self. I'm very thankful for the cancer center, and I'm thankful for my wife and family who were awesome caregivers through that entire process. This week I'm coming up on a cystoscopy where the doctors are going to go into my bladder and inspect it to see if there's any cancer growing, and I pray that they find nothing.